So about German helmet technique, before that Reed's baseline. So if this is our whole brain RT field, this is our Reed's baseline. It is the line joining the superior orbital ridge to the upper border of the external auditory canal, and 1 centimeter anteriorly fall off, 1 centimeter superiorly, and 1 centimeter posteriorly. That will be our field. So here this is the base of skull. You will also include the base of the skull, 3 centimeter below and 3 centimeters above the Reed's baseline. So you will stop at the posterior end of the orbit, or you can also use an eye shield over here. Posteriorly, once you will include the occiput and 1 centimeter to that uh, a fall off. Then coming to German helmet as such, German helmet, like, it's usually used in PCI, that is prophylactic cranial irradiation, and the inferior border will be C2 vertebrae, that is the bottom of the C2 vertebrae, and anteriorly will be the 1 centimeter fall off as such, but once 2 centimeters inferiorly, 2 centimeters posterior to the lens. And here we will also try to include the cribriform plate. Here we are trying to include the optic nerve cribriform plate over here. Now, so this gives that shape of our German helmet as such. That's why it's called German helmet technique. And yeah, so about the images in radiological. So this is how Reed's baseline, that is connecting the uh, external auditory canal and the superior orbital ridge as such. Okay, now again same image connecting that, this will be the field. This is okay. Now coming to German helmet technique as such. So this is our conventional 2D field with in German helmet you will block this area where there is eye, and so here cribriform plate you will include, and you have to include the hypophysis here, and you have to also include the temporal lobe, and the inferior border will be C2 vertebrae, and it's 0.5 centimeters cribriform plate, 0.5 centimeters from the whatever you can see the base, anteriorly to 2 centimeters posterior to the lens. Now again the same, this is like exposure, this is the block that has been used, this will be the German helmet technique. The same thing using she being used in current technology. And yeah, nowadays we use MLCs which almost approximate the whole area. Here over here, like, it is like fall off, fall off, fall off, but yeah, so you can see the MLC is covering completely over here. So you include the hypophysis, the posterior part of the lens, 2 centimeters behind the lens, and C2 vertebrae is the lower level. So you can see here the C2 vertebrae level, or in this image C2 vertebrae. This is C1, this is C2. Now yeah, so posterior, if this is our lens, 2 centimeters posteriorly you will include the posterior globes of the eyes as well, because we are trying to cover the optic nerves, because meninges will cover over there, right? So CSF circulates in that around the optic nerve. So, and therefore we will also include the orbital apex for the German helmet technique, and you will go until the C1 and C2 vertebrae lower border to prevent high risk of because there is high risk of recurrences over there.